Hello. Hi. Hello, all. Ladies and gentlemen, and honorable guests, journalists, media experts, I'm Dr. Yogi Gundamraj, and I welcome you all to inauguration of our innovative multi-specialty telehealth concierge medical group, MyAmerican Doctor. And today marks a significant milestone in healthcare delivery as we introduce a service designated to provide personalized, accessible, and comprehensive care to our community. In our fast-paced world, healthcare needs to adapt and evolve. Our company brings together a team of dedicated US-based multi-specialty physicians, practicing doctors committed to providing top-tier medical expertise, opinion, right at your fingertips, at your home. With this telehealth, we bridge the gap between the patients and healthcare providers, ensuring that quality care is just a click away. In short, to say about our group, we are a group of US-based practicing multi-specialty doctors with similar unified interest of serving the patients in India, got connected together and formed MyAmerican Doctor. And here on dais, we have our CEO, Dr. Raj Narla. The founder and visionary behind our company, with a passion of innovation and commitment to enhancing healthcare accessibility, has been the driving force in bringing this telehealth concierge medicine service to life with his relentless efforts. Dr. Narla. Dr. Daniel Friedman, practicing fellowship-trained dermatologist, director and founder of Westlake Dermatology Clinical Research Center, part owner of Westlake Dermatology and Cosmetic Surgery with 20 locations in Austin, Texas. Nearly 70 publications in the peer-reviewed medical literature and 15 book chapters. Dr. Daniel Friedman. Dr. Rajan Garg, practicing critical care doctor. Dr. Garg has multiple long list of affiliations and honors. Currently serves as ICU Medical Director at Hollywood Presbyterian Hospital and USC Arcadia Hospital. Dr. Rajan Garg. Lastly, I'm Dr. Yogi Gundamraj. I'm practicing internal medicine, addiction medicine, and urgent care for the past 25 years in Chicago area. Fellow of American Society of Addiction Medicine. My passion is to treat addiction and eradicate it. And my motto is to make world great again, addiction free. So, thank you. I'm also delighted to introduce our Zoom.
Yeah, we have, I don't know when they're.
Okay. Okay. We have a whole bunch of doctors, part of our group, who are going to join us on the Zoom here. And I'm very delighted to introduce our remarkable team of multi-specialty doctors joining the event from US and here on Zoom call. Each doctor brings a wealth of experience and a dedication to providing the highest quality of care to our patients. Their collaboration across specialties ensures that we deliver comprehensive and tailored medical service to meet diverse needs. Doctors on Zoom. Our platform empowers patients with convenient access to specialties across various fields, from primary care to advanced specialties like neurosurgery. We are committed to delivering not only medical expertise, but also compassionate care tailored to each individual's needs. Through this service, we aim to enhance patient outcomes, reduce wait times, and eliminate geographical barriers, making healthcare more inclusive and efficient. Our concierge model ensures that every patient receives a personalized attention and a seamless experience. Thank you all for joining us on this exciting journey. We look forward to revolutionizing healthcare together, making it more accessible and patient-centered. Here's to the healthier future. Thank you. Now, Dr. Rajan Garg will say some more words about our group, and Dr. Garg.
Thank you, Dr. Gundamraj, and thank you all for joining and giving us this opportunity to launch our company today. I would start by first discussing the need for this kind of service in India. Almost over 1 million patients are traveling abroad every year to seek medical treatment for complex medical conditions, rare diseases, difficult diagnosis, and for privacy reasons. Apart from those, there are approximately 4 times more patients who would like to travel or get an expert medical opinion from physicians abroad if they had the resources available. And then there is also a certain perception that the treatment abroad is better, and right or wrong, but that perception does exist, and so sometimes that creates the opportunity. Are my results accurate? Which type of treatment is best? Do I need surgery? We all, I think, go through these kind of questions in our heads. And MyAmerican doctor's goal is to provide the latest treatment plan to Indian patients in India using the technology. We plan to collaborate with the physicians and hospital healthcare systems in India. Indian healthcare systems and doctors are comparable to anywhere in the world, the best in the world. Sometimes patients just need the reassurance that the treatment being provided to them by their Indian healthcare system and the doctor is the right treatment, and sometimes the treatment plans needs a small tweaking. Our goal is to provide the reassurance without dislocating the patient from the comfort of their home or their healthcare system and their current care provider in India. I wanted to share some data, clinical studies that have been done on second opinion consults and how they can help, how they can help improve the outcomes in patients. So this first study, is about histopathological diagnosis in pathology, and this is a Japanese study. And in this study, they showed that approximately more than 50% of the cases, there was a change of diagnosis after obtaining a second opinion expert consultation. And this was a study of about 270 patients, so it's a good size study. This is a study from Journal of Clinical Oncology, which showed that the second opinion consultations there was a significant change in management of the patients. In this study, there were close to, I think, somewhere between 300 to 600 patients in 2 different separate arms, and there was a treatment change in more than 50% of the cases. And if you look at the highlighted section over here, the most complex type of cases, stage 4 cancers, there was approximately 57% of the patients who had a change in treatment plan after having a second opinion. Then there was approximately 20% of the patients over here who had a major change in treatment, and approximately 30% of the patients had a minor change in treatment. So approximately 50% of the patients had a change in treatment. My own mother had a diagnosis of early stage breast cancer back in 2018, and my sister is a pathologist in India over here, and we actually needed 2 or 3 opinions, and the treatment plan changed after every opinion. So it took a lot of advice and opinions to get to the right treatment. So I'm sure all of us sitting over here have our own version of similar stories. This is a study from Mayo Clinic, pretty much saying the same thing that we discussed earlier. Approximately 26 to 50% of the patients had a decrease in the diagnosis error after second opinion, and in certain cases they also did third opinion and decreased the error rate to less than 16%. What I found interesting in this study was there was approximately 1 in 5 patients in this study that had a completely different diagnosis after the second opinion. And approximately 9 out of 10 patients had either refinement of their first diagnosis or a completely different diagnosis. That makes it 87% of the patients either had a change in diagnosis or a new diagnosis. Who we are, like Dr. Gundam Raj said, MyAmerican Doctor is a American company founded, operated, and owned by U.S. board certified and trained physicians to address this exact need that we are discussing for expert medical opinions globally. And we aim to bridge the gaps in healthcare access by offering secure and accessible telehealth services. Our leadership team, you already heard about Dr. Raj Narla. He is the CEO and co-founder, and he's an expert in emergency medicine, practicing nationally and internationally for quite some time. Dr. Deepak Thomas, he's our Chief Medical Officer and co-founder. Dr. Thomas is an experienced cardiologist with a specialization in nuclear cardiology and cardiovascular imaging. We have Dr. Rishikesh Ganekar. He's our COO and an experienced nephrologist based in Illinois with over 25 years experience of managing kidney diseases and hypertension. And then we have Dr. Suresh Reddy. He's our Chief Technology Officer, highly experienced radiologist physician, known for his exceptional care in diverse healthcare settings across the United States. You probably saw some of our team members already, but we have a team of 40 physicians, 40 plus physicians across 30 plus specialties, and all of our physicians are either trained or are currently practicing in some of the best institutions in the country. As we said before, what are we offering? We are offering secure, accessible, and comprehensive medical care plan using advanced telemedicine technology with complete privacy. These are some of the specialties and subspecialties that we offer. You can see the pictures on the board across the board, but we have specialties across medical and surgical specialties, including some of the super specialties which are sometimes challenging to find in regions in India, like neuroendovascular care, or sometimes neurosurgery or advanced cardiothoracic care. Who can use our service? Patients who have complex clinical conditions, patients who have rare clinical conditions, patients who need a second opinion about their diagnosis and treatment plans, patients who would like to know more about the latest diagnosis and treatment options available for various medical conditions. And also, lastly, but equally important, is a collaborative care. If you need care collaboration, you want your family members to be involved, or you want your primary care doctor or healthcare system, we're more than happy to collaborate the care among the whole entire care team. And we have the technology available to do that. The process of reaching out to us is fairly straightforward. It's step one is basically reaching out to us using our website and scheduling an appointment, and somebody will reach out to you within 24 hours. And step two is a live intake and record collection with a local doctor who is also going to be part of our team. And they will do the digital data collection and also collect any additional documents required for the consultation with the expert physician in US. And step three will be the virtual consultation with the expert physician using telemedicine platform. And step four, right after the consultation, you will receive a summary and the recommendations in a written format in your chart. How are we different? I think that's very important. There are a lot of companies that are offering some kinds of telehealth services across the globe, actually. What makes us different is that we provide all of these things together. We provide consultation with an expert American doctor within a reasonable time frame at a reasonable price, and we offer the collaboration among the care team, and we also provide you the access to the digital health records. And this is just to compare some of the other competitor companies that we can see from US. All of the companies do not offer everything that we offer, and I think one of our sticking point was the price point. Services that are being offered by some of the other companies are clearly not affordable to patients in India. And our whole point of starting this service was to increase the accessibility, and we want to make this service available to majority of the Indian population. So here we are. Contact us today if you have any healthcare needs. Thank you. And I would like to introduce Dr. Daniel Friedman, who is supposed to launch our website. Yeah, thank you.
We are good to go. Okay, here we go. Yeah. Thank you.
Next, I'm going to introduce our CEO, Dr. Raj Narla. So if he can say a few words, please. Thank you.
Hello, first of all, I'm Raj Narla. I'm the CEO of this company. I would like to thank everyone here who's present for making this happen. Firstly, I would like to thank the whole group of MyAmerican doctors. We are 50 of us, with 30 plus specialties. Special thanks to Dr. Rajan, Dr. Gundam Rajan, Daniel, who have made it here in a short notice, and they're just here for about 24 hours. I really appreciate that. I also would like to thank all our MyAmerican group of doctors who have collaborated on this collective effort. And a special thanks to Dr. Cole Moody, who is our advisor and helped us shape the company and advise us as we navigate this company. And lastly, I would also thank everyone present here and the press who have made it here on a Saturday and given us their time. Given that, I'm open to any questions from all of us if anyone has questions. Again, thank you all.
Hello.
Can you hear me? Your question is, how do we do surgery?
If need surgery patient, how can you operate, sir? From America.
So we are basically a second opinion service. We do not do surgeries at this point. What we do is we can consult on your case and answer your questions. The patient may have questions like, is this surgery appropriate for me? Like, for example, if somebody recommends bypass surgery for you and you want to get a second opinion before going through this complex surgery, we can help you, advise you, and help you out in the decision-making process in consultation with your local doctor, basically.
India is a very price-sensitive market. So how do you really, ensure that your price is competitive, there are good number of hospitals in India as well and diagnostic centers. And does it imply that the diagnoses are going wrong? Because you said in oncology there were several cases which needed a second opinion. So could you just elaborate on that?
So hello? The studies that we discussed, those are actually not studies based on any, this doesn't imply that any wrong diagnoses are being made in India. That actually studies, those are international studies across the globe. The wrong diagnosis or, the diagnosis requiring a change, that is nothing new actually. The complex medical conditions or surgical conditions can be very complex to diagnose and to treat. Sometimes it requires multiple set of eyes and multiple different experts to get to that point. The whole point of this showing this data is that sometimes when the medical conditions are complex, for example, stage 4 cancers, a lot of the times there is no straight answer. A lot of the times you need a second opinion, and that is the gap that we are trying to fill, that if you need an extra set of eyes and if you need an extra, you need an expert opinion from a different part of the world who's also been doing this in a different clinical setting, we are here to provide that service for you.
Thank you.
And the second question that you mentioned about the price points, we actually priced this service, like we mentioned, it's a relatively cheap compared to any other similar service that's being provided by any other company in India for this level of service. So we think our price point is fairly competitive, and given even the Indian prices for healthcare these days, we think we are in a sweet spot where we can actually cater to a much bigger population rather than just catering to very few people who can afford higher prices. That was the whole point, that we wanted to keep the prices on the lower end.
So is there stress on oncology or other fields as well?
No, it's actually, our service will be across 30 plus specialties. Oncology we listed because the study was done on oncology patients, and oncology can be one of the more common ones. For example, the second one will be cardiology, could be a more common one. Patients with chest pain, with patients with the heart failures and stuff. And same things in neurology, stroke patients can sometimes be a more common one. Dermatology can be a common one, as we know. So we have 30 plus specialties, including ICU care, emergency room, internal medicine, and addiction health. So we have and a lot of surgical specialties. And like I also mentioned before, I think it's we also are including some experts that are not easily available in Indian subcontinent sometimes. I have again a personal example. My brother-in-law, who's a dermatologist himself in Punjab, he had a vascular lesion on the foot, and he was trying to get hold of a vascular surgeon. We found out that the closest vascular surgeon who can manage that is in Chandigarh or Delhi. So it took him 1 week to find that, and he had to go through us to get some advice from my friends in US. So it's not that we are saying that by any means the right diagnosis is not being provided, or the specialists are not here, but sometimes the access can be a problem, and we can solve that problem by giving them this expert opinion in the comfort of their own home. And going back to this gentleman's question when he asked about the procedures, we don't plan to do any procedures. Our job will be to help you guide in the right direction, provide you with the expert opinion, and give you the latest treatment options that are available to you wherever they can be.
Just for curiosity's sake, a question. I wanted to know, because in India what happens is the patients love, facing the doctor. It's the pulse that the doctor holds is important. So telemedicine, how do you think is going to, of course technology has advanced, but how do you think this telemedicine is going to help Indian patients?
So the key point will be, we are not taking the Indian doctor away. The Indian doctor is the one who has done the examinations. They have collected the data, and they have collected the data like the lab studies or any of the treatment plans they have done. So we are going to have Indian doctor as part of our team who's going to collect all that data, and then that data will be interpreted by our experts in US. And if they need more information, that's the time when they talk to the patients, they will ask any appropriate questions, or if they need more data, they will ask for that data. But the expert opinion will be provided based on the data rather than actually examining the patient, because that is still being done by patient's primary doctor in India.
So as you told, you said here. As you told, you said you have more specialties and experts. If a person is consulting about his heart condition, how much time it takes to reach you, exact expert?
Your question is how responsive we are?
Yes.
So we like to finish the consult with a written report in 72 hours. So if you messaged us on our website, we would probably expect an instantaneous response, but we say that we'll get back to you in 24 hours. And then we'll schedule an appointment with our Indian doctor who will first collect all the information, like your records, CT scans and stuff like that. And then within 48 to 72 hours, we'll finish the consult and we'll send you a written report and recommendations.
Thank you. So if a person is in pain, most of the people doesn't speak in English.
Right.
So what is the alternative for the patient?
Yeah, if somebody is in acute pain, we are not the right service to consult. They should go to the nearest doctor or emergency room to get rid of the pain. What we address is patients who are not in acute pain, and then we talk to them and give them a second opinion, basically. So if you are in acute pain, please do not contact us. Please go wherever you get some acute care.
So if we open the platform, like you mentioned, My Doctor.
MyAmerican Doctor.
Yes, MyAmericanDoctor.com. So we have to accept all the cookies. So we are sharing our personal data, like location, phone number, email ID, and everything. There would be a chance of popping up like third-party things like links. So if a person click on it, it will be like a scam. What all the solution? What is the solution for it? What are the things you've taken?
If I understand your question correctly, are you asking about data privacy?
Yes. Third-party links also.
Okay, so first is we're not selling your data or emails or phone numbers to any third parties. We don't have any affiliations with any pharmaceutical companies or anything like that. We don't sell your data. And as far as your medical records are there, they're securely stored with highest level of security.
Actually, I'm not telling you are selling it out, but there would be a chance, since it is a platform, we have to accept all the cookies.
Yeah.
So I saw the app just now, like I opened the platform. There I saw strictly necessary to accept the cookies. So there would be a chance of clicking on third-party cookie, like third parties. What are the measures you have taken?
So we don't have any third-party affiliations with the cookie storage, but I can get back to you after consulting with our technical team. I may not have the right answer right now, to be honest. I actually don't even understand exactly. I'm not the tech person, but I'm happy to get back to you and answer the question later. But as far as I know, we don't have any third-party cookies embedded to capture any sensitive information.
Okay. Thank you.
You're welcome.
To your question, the platform which we use, the ICA platform, it is actually HIPAA compliant. In US, we have something called patient confidentiality, and that's HIPAA confidentiality. And ICA is one of the HIPAA compliant platform. So that's why we have chosen ICA as our platform. So it should be good enough and very secure, and patient confidentiality is assured on that platform, I guess. So as Dr. Narla said, the technicalities of these cookies, we are not sure exactly about that, but I don't think it has got much to do with the leaking of patient data in any ways.
I just wanted to add one more thing. Being a US-based physician company, we have to comply with we have the strictest regulations when it comes to patient data, HIPAA compliance, and how do we share that with anybody. I'm based in California, and we have some of the strictest laws. So our website and ECUB and the EMR software that we are using, we are actually choosing every single security step based off of our own US guidelines as well. So we, again, like Dr. Narla mentioned, we don't expect there to be any data-related issues. That we have taken all the necessary precautions. But the technical question, we can get back to you with consulting with the IT team. Yeah.
Sure, thank you.
We'll give you the mic.
How do you access the rural patients? I understand it's technology, but they're still uneducated on that.
So yes, that is a challenge that, of course, we technology access has to be there wherever we are going to make our service available. So if somebody has basic internet connection, they are able to access our service. Now, one challenge that you always see with what you mentioned, rural area. I come from North India, so sometimes the language barrier can be an issue. So we're launching our service in English language only as of right now, but we very quickly plan to add local regional languages as we expand. A lot of us, among 50 of us, each one of us speak 2 to 3 languages in any case. But that being said, if I'm an ICU doctor and if the patient needs a dermatologist, we also need to have a dermatologist who can understand that language. So we're going to add language services very quickly so we can cater to crowds who cannot speak the English language.
He's saying any expansion out of Hyderabad, right? We're a global company with global ambitions now, but we're starting out with India. So our website is accessible to everyone around the world, but right now we are focused on only servicing patients in India. Ravi, you have a question?
Yeah, so I think nowadays everybody using technology to actually check on doctors. I've seen like a lot of ads in India where old people are going to the doctors and they're getting some prescription and they're just Googling it out and then seeing the data and all that. That is actually risky. I think this is a great service in that you can quickly get access to one of the kind of the experts, right? I think Google or the AI cannot replace the doctors. They can only do like some basic service, but this is great actually. And my question is is it only for the people in India? What about people for majority of Indians in the US? You guys have any plans in that?
I will take that. So first thing that you mentioned about having an expert to give the actual knowledge rather than Google or all that. So that is very close to us, I think, and we all as US physicians also see a lot of patients dealing with complications or not getting the appropriate treatments because of misinformation per se. I wouldn't say wrong information, but they're not getting correct information from the correct sources. So that is one of the key components to our platform. Educating the patient, giving them the right information, empowering the patient, that is the key to our success. And this is, in the beginning, we're just starting this as a service, but within the next couple of days, we are also starting a blog section where we will be adding educational sections. What do you do with the common conditions? What do you do when you have chest pain? What do you do when one side of your face is not moving? What do you do in different situations? So one of our goals is to educate the patients, and that education will be available to patients across the world. And to answer your second question, I'm going to let Dr. Narla answer that too, but our plan is to expand to US also in one form or the other. But I think we want to focus our efforts right now in India, but we're very mindful of the fact that there are a lot of Indians who have moved to US and their parents are also over there also, including some of us. So that is a service that's necessary, and absolutely we plan to address that in the near future. Dr. Narla.
Thank you. As far as our US expansion, we are right now focused heavily in India and probably Middle East, but we would eventually get to US and do services there. Again, to emphasize our price point, it seems expensive for $149, but most doctors, we all have plenty of work in US. It's mostly like a service initiative so that we can help people. All of us get consults on WhatsApp, like, this happened, my mother is in ICU, or somebody got diagnosed with cancer, all of us get once or twice a week these type of consults. So we want to do this in an organized way to help our families back home and fellow Indians, so that we have appropriate medical record keeping and we give timely and appropriate advice. So that's the main service initiative that we're focused on, not a very commercially oriented entity at this point.
One thing I would like to add is I gave my own family's examples. I consider ourselves privileged because we have access to healthcare and experts in US and across the world, actually, if we want to, because we have a lot of colleagues, friends, or sometimes family members who can help us. That's the same service we're trying to offer it to general public. Our friends and families can reach out to us on WhatsApp and stuff, but how do 99.9% of the rest of the general public get the same service? So that was our idea behind offering this as a service, so everybody who needs help can access the same level of care that is available to anybody who is, I would say, privileged.
Questions?
I don't have a question, but I would like to add something. There is a recent which mentioned that more than 44% of the sections done in private hospitals is not required in India. Yes, and more than 55% of cardiac surgery is not required. It could have been avoided in India. So, but only thing is, how do you, supposing I get an opinion and I take your opinion to the local doctor, he brushes off saying that what the guy knows sitting over there. How does the patient get an assurance? Or firmly can you say that this is not required? You better change always what we see here in medical, with the doctors is, they say, in your interest I am advising you. They don't say it is required. It happened to me 5 years back. I was going with my daughter who is a dentist. She said, you did not get yourself diagnosed for 1 year. So we just walked into a diagnostic center. She took a ECG, and there came a computer printout saying that there may be some deviation. And the doctor who did the scanning, he said, is all right. My daughter insisted. When I went to a hospital, he did several tests, and then they said, it is in your interest, we advise you to go for a surgery. I said, decide whether I need it or not. So what I did is, I had a classmate, my daughter and another doctor. I told them, this is not my expertise. I leave it to you. You decide. If you think it is required, I'll go for it. Or you decide it is not required, because I have no stroke, I have no pain, no symptom, and even where the block is there, collaterals got developed. So I personally, logically thinking, I said it may not be required. But the team, they said, I need it, so I gave them the permission. I had a bypass done 5 years back. So what I'm saying is, find a way where it can be imposed on the erring doctor that what he's doing is an error. That's it.
I'll answer this the best way I can. First thing is, like I mentioned before, our goal is to provide you the treatment options that are based off of evidence, okay, and the latest treatment guidelines. And we're more than happy to provide you the copies of those literature if requested by yourself or by the doctor. And the second component to that is collaborative care. Our goal is to collaborate the care with the physicians. We're not trying to leave the patients to deal with the doctor, and if there is a disagreement. In case there is a disagreement or our treatment recommendations are slightly different or completely different from the treatment that's being offered to you over here, in that case we're more than happy to collaborate with the local physician and have the patient on the call so we can help you navigate that challenge. Okay, so Dr. Narla, any?
I think that's good enough answer, yeah. Any? Again, thank you all for coming. We really appreciate all of you taking the time on Saturday to come here. And on that note, we welcome you to our lunch. Please, we're available in the lobby if you guys have any further questions or interviews. Thank you again.